So good evening to all of you and welcome back to this MCQ and image based revision. I am Dr. Pradeep Pawar, Professor of Anatomy. I've got a vast experience of teaching the postgraduate entrance students, India as well as abroad, and the undergraduate students too. Okay, so we start with the MCQs. Have a look. Starting with the first MCQ. Good evening, good evening. Identify this pointed structure. Good evening to all of you. Okay, chalo start. Identify this pointed structure. A very important visual. This is a very important visual for you. You can see this now very clearly. I need not magnify this. Identify this pointed structure. Yes, you can guess, you can answer. That's okay. Even if it is wrong, it's okay. Come on, students. This is which compartment of the leg is this? First, try to understand this. Which compartment of the leg is this? This is the posterior compartment of the leg muscles. है ना? ये muscles are posterior compartment of the leg. So then immediately just try to think about the posterior compartment of the leg. Superficial muscles, yes, the superficial muscles were gastrocnemius, soleus and plantaris, and those three together forms a common tendon. What is this? That's the tendoachilles or the tendocalcaneus, which is inserted on the calcaneum. Fine. Now we are left with the deep muscles in the posterior compartment of the leg. Out of those four deep muscles, one is popliteus, which is inserted very high up on the tibia. And what is the action of popliteus? It's unlocking of the knee joint. And popliteus does unlocking of the knee joint. Now we are left with only three muscles: tibialis posterior, flexor hallucis longus, and the flexor digitorum longus. Tibialis posterior, flexor hallucis, and the flexor digitorum longus. Yes. So what is this? This tibialis posterior, not anterior, I'm so sorry. Tibialis posterior, flexor hallucis longus, and flexor digitorum longus. Yes. So this is the tibialis posterior. Tibialis posterior. And how do we know that this is tibialis posterior, students? Because this tibialis posterior is going to hook around. It winds around the medial malleolus. Is this clear to all of you? The tendon which winds around the medial malleolus, that's the tibialis posterior. Can anyone tell me where is the main insertion of tibialis posterior? A very important MCQ. Which is the chief insertion of tibialis posterior? If there's, if this tibialis posterior gets ruptured, this part of the bone is pulled off by the muscle. So which is that bone into which the tibialis posterior is principally inserted? Can anyone answer this? That's the tuberosity of navicular bone. The navicular tuberosity. Tuberosity of navicular bone, and into this navicular tuberosity is the chief insertion of tibialis posterior. So by any chance, if the tibialis posterior is ruptured, there is avulsion of the navicular tuberosity. Just remember this. A very important thing to be remembered. A very important MCQ. So that's tibialis posterior. What is the next muscle? This one. This muscle is the flexor digitorum longus. Flexor digitorum longus. And this flexor digitorum longus would go laterally. It goes towards the fingers. Flexor digitorum longus. And the last tendon is the flexor hallucis longus. This is the flexor hallucis longus. And this flexor hallucis longus and digitorum longus, something very, very important about them. I'll quickly tell you this. If you can answer this, look. This is the tibia. One moment. That's the tibia here. That's the medial malleolus of the tibia, and that's the fibula here. That's the lateral malleolus of the fibula. What is this line on tibia? Can anyone tell me what is this line on the tibia known as? Yes. What is this line on tibia known as? This is the soleal line of tibia. Soleal line. And this soleal line gives origin to the soleus muscle. Above the soleal line of tibia is the insertion of a muscle. Can anyone tell me? Yes, what is this muscle which is inserted above the soleal line? Yes, students, answer this. This is a muscle which is intracapsular in origin. You should be able to answer this. A muscle which is intracapsular in origin, a muscle which begins from the lateral condyle of femur. That's the popliteus muscle. Yes, this is the popliteus muscle, and this popliteus muscle is inserted above the soleal line of tibia. Fine. So that soleus is over. अब अपने पास तीन muscles है. Tibialis posterior, flexor hallucis longus and flexor digitorum longus. Just understand this concept. You'll be very clear then. See, we divide the tibia into two halves. We divide the fibula into two halves. And this muscle which begins from the tibia, fibula and interosseous membrane. ये क्या होगा? Tibialis posterior. That's the tibialis posterior. So the muscle which begins from which half of tibia is left here? The lateral half of tibia, the medial half of fibula. That's the tibialis posterior. Now tell me, which half of tibia is this? The medial half of tibia, and that's the lateral half of fibula. Students, ideally, the muscle which begins from the tibia would go to the great toe, and the muscle which begins from the fibula would go to the digits. That means ideally the muscle which would arise from the tibia would be what? Flexor hallucis longus. And the muscle which arises from the fibula has to be flexor digitorum longus. But remember, muscles in the posterior compartment of the leg, they arise from wrong bones. They arise from wrong bones. So the muscle which arises from this bone, from the tibia, is what? Flexor digitorum longus. And the muscle which arises from the fibula is flexor hallucis longus. बस ये concept याद रखना. So flexor digitorum longus begins from which bone? Tibia. Hallucis begins from fibula. When both these muscles come in the sole, they are going to cross each other. They are going to cross each other in the sole. And why do they cross each other? Because they originate from wrong bones. They arise from wrong bones. So just remember this slide. This is a very important slide. ये है popliteus. Clear to all of you? So flexor digitorum longus begins from which half of tibia? Medial half of tibia. Flexor hallucis longus begins from the lateral half of fibula. So both these muscles, when they come in the sole, they are going to cross each other. So have a look at this slide now. So what is this? This is the flexor digitorum longus which is going laterally, and this is the flexor hallucis longus. See, you can see these two muscles are crossing here. Two muscles are crossing in the sole. I hope this should be clear to all of you. Which layer of the sole do they cross? If you know this, automatically you know the layers in the sole, in the second layer of sole. So students, in the second layer of sole, you get two muscles. Which are those two muscles? Flexor hallucis longus and flexor digitorum longus. Perfect. Okay, can anyone identify this tendon? Chalo, I put a star on this. What is this tendon of? Another extremely important MCQ for you. Very important visual for you. What is this tendon of? Can anyone answer this? This is a muscle of the anterior compartment of the leg. Anterior compartment of leg, anterior compartment. Flexor nahi hai, Shasti. It's not flexor. This is the tibialis anterior. Very good, Revati. That's tibialis anterior. This is tibialis anterior. And the main action of tibialis anterior is dorsiflexion, as well as it turns the foot inwards. Inwards. What's that? Inversion. Inversion. So action of tibialis anterior will be dorsiflexion and inversion. This is going to be the extensor hallucis longus. Extensor hallucis longus. Can anyone tell me what is this ligament here? What is this ligament? Beginning from the medial malleolus, and this ligament is having three parts. From the tibia to the navicular bone, tibio-navicular, from the tibia to the talus, tibio-talar, from the tibia to the calcaneum, that's tibio-calcaneal. Yes, okay, fine, Shasti. So what is that triangular ligament? Can anyone answer this? This is the deltoid ligament. Perfect, very good. So that's the deltoid ligament, and deltoid ligament के तीन parts होते हैं बच्चों. Just remember this. You get MCQs on this. Tibio-navicular, tibio-talar and tibio-calcaneal part. So that's deltoid. And this deltoid ligament can be injured in which moment of the ankle or in which moment of the foot would this deltoid ligament be injured? So this deltoid ligament will be injured in which moment? If there's a excessive eversion. If there's a hyper-eversion, this ligament would be injured. That's deltoid ligament. Yes. Eversion. If there's a forceful inversion, the ligaments on the lateral side would be injured. Agar inversion karte na, so the stress is on the lateral side. So the calcaneofibular ligament is injured if there's a hyperinversion. Clear? Yes. Okay, fine. So we'll go to the next MCQ. Have a look at this. Yeah. So 60 years old male was diagnosed as carcinoma of the testis. An orchidectomy was planned. The surgery resident was recollecting the lymphatic drainage of testis. Testis drains into which of the following lymph nodes? Yes, students. A very important MCQ, and this you should know. So testis has descended down from the abdomen. So it is, yes, which lymph node? Testis and ovary drains into the para-aortic lymph nodes. Remember the students? Testis and ovary, they drain into the para-aortic lymph nodes. Para-aortic. Clear to all of you? Tell me, the external genitals drains into which lymph nodes? Can anyone answer this? The external genitals, except the glans penis and the glans clitoris, drains into what? Answer this, students. The skin over the external genitalia, except the glans penis and glans clitoris, that drains into superficial inguinal lymph nodes, except the glans penis and glans clitoris. The glans penis and glans clitoris drains into the deep inguinal lymph nodes. Deep inguinal lymph node, that's the lymph node of Clocket. Deep inguinal lymph node, that's the lymph node of Clocket. Yes. Clear to all of you? Yes. So the superficial inguinal lymph nodes drains, the vertical group drains the lower limb. The superficial inguinal lymph nodes is in the form of a T like this, and a T. This is the medial group, and this is the lateral group, and this is the vertical group, So the vertical group drains the lower limb. The upper medial group, what do they drain? The upper medial, quickly I'm just telling you this, I'm not writing anything. Tell me, the upper medial group drains the anterior abdominal wall below the umbilicus, the skin over the anterior abdominal wall below the umbilicus. It drains the perineum and the external genitals. It drains the perineum and the external genitals, except the glans penis and the glans clitoris. It drains the penile part of the male urethra. It drains the anal canal below the dentate line. It drains the vagina below the hymen. And it drains a part of the uterus. Can anyone tell me which part of the uterus drains into the superficial inguinal lymph nodes? Which is that part of the uterus which drains into the superficial inguinal, the cornu of the uterus, the cornu. The attachment of fallopian tubes with the body of the uterus, that's the cornu of the uterus. Clear? So once again, the upper medial group drains into what? One, upper medial group of the superficial inguinal lymph nodes, the horizontal upper medial drains the skin of the anterior abdominal wall below the umbilicus, the perineum including the external genitals except the glans penis and the glans clitoris. It drains the penile part of the male urethra. Yes, it drains the anal canal below the dentate line. It drains the vagina below the hymen, and it drains the cornu of the uterus. What is cornu? Cornu is the junction of the fallopian tubes with the body of the uterus. Jahan pe ye fallopian tubes are attached to the body, that point is known as cornu, to which the round ligament is attached to. Clear, Mohit? Yes, that's the cornu of the uterus. So this drains into the upper medial group. The upper lateral group drains what? The back below the umbilicus. It drains the back below the umbilicus. It drains the lateral aspect of the thigh, and it drains the gluteal region. Okay, back below the umbilicus, the lateral aspect of the thigh and the gluteal region, the upper lateral group of lymph nodes. So I hope this is clear to all of you. A very important MCQ. Yes, very good. Come on, students, coming to the next MCQ. Here we are. Answer this. What is this arrow pointing to? Yes, above the dentate line is interiliac. Yes. What is this arrow pointing to? Can anyone answer this? You can see a small opening there. Yes, what is this structure? what is this structure? ये क्या bone है? What is this bone? This is the hyoid bone, है ना? This is the hyoid bone. And what is this cartilage? This is the thyroid cartilage. So between the hyoid and the thyroid, yes. What is this? What is this membrane? ये जो membrane देख रहे हो आप, this membrane is the thyrohyoid membrane. Between the hyoid bone and the thyrohyoid, between the hyoid bone and the thyroid cartilage, वो जो membrane है, that's the thyrohyoid membrane, and there's a small opening in the thyrohyoid membrane. Who comes through this opening? It's not recurrent laryngeal. Ashutosh, it's not recurrent laryngeal. Who comes through this thyrohyoid membrane? That small opening in the thyrohyoid membrane is for what? This is extremely important, students. This you should know. There's a nerve and there's an artery which comes through this thyrohyoid membrane. Can anyone answer this? There's a nerve and there's an artery which comes in through this thyrohyoid membrane. And what is this area here? What is this area? ये क्या area है? मतलब what is this fold here? This is the aryepiglottic folds. बराबर ये aryepiglottic fold है, and that's the thyrohyoid membrane. So thyrohyoid membrane is lateral and the aryepiglottic fold is medial, and between them is a fossa which we call as the pyriform fossa. ये है pyriform fossa. Pyriform fossa, also known as the smuggler's pouch. This is also known as the smuggler's pouch. Pyriform fossa के boundaries clear है. Aryepiglottic folds on the medial side. Medially aryepiglottic folds होंगे. Laterally is the thyrohyoid membrane, and between them that fossa is known as the pyriform fossa. And who comes into the pyriform fossa? The internal laryngeal nerve and the superior laryngeal artery. Perfect. Internal laryngeal nerve and the superior laryngeal artery is going to supply the pyriform fossa. It supplies the pyriform fossa also. And this internal laryngeal nerve is the same nerve which initiates the cuff reflex. Cuff reflex initiate करता है internal laryngeal nerve. Clear to all of you? Yeah, on the lateral side is thyroid membrane and thyroid cartilage. Yes. Thyroid membrane and thyroid cartilage. बराबर है. That's the pyriform fossa. Yes, thyroid membrane and thyroid cartilage. Correct you are. This superior laryngeal artery is a branch of which artery? Can anyone answer this? Superior laryngeal artery is a branch of. Superior laryngeal artery is a branch of. Can anyone answer this? Superior laryngeal artery is a branch of. Answer. External carotid nahi. Superior laryngeal artery I'm asking. I'm not asking superior thyroid artery. I'm asking you superior laryngeal artery is a branch of. It's a branch of superior thyroid artery. समझ में आ रही है? So external laryngeal artery का branch है superior thyroid, and superior thyroid gives an artery which is known as superior laryngeal artery. Superior laryngeal artery. So what passes through this thyroid membrane is clear. The internal laryngeal nerve and the superior laryngeal artery. And this internal laryngeal nerve is going, then enters into the pharynx. It supplies the pharynx and the larynx. It supplies the mucous membrane of the larynx above the vocal folds. It also supplies the posterior most part of the tongue and epiglottis. Posterior most part of the tongue and epiglottis. Perfect. Perfect. Now tell me, students, answer this. Epiphysis is of multiple types. Which of the following is an example of epiphysis which takes part in joint formation and is not involved with the pull of the muscles instead? Can anyone answer this? An epiphysis which is involved in joint formation. What is that type of epiphysis known as? Epiphysis which is present at the ends of long bones which takes part in the formation of joint. What is that epiphysis known as? It is known as the pressure epiphysis. Pressure epiphysis. Epiphysis which takes part in the formation of joint. Joint, Rasti, it's joint. कोरोकॉइड प्रोसेस नहीं है इसका आंसर. which takes part in the formation of joint and not involved in pull of the muscle. It is pressure epiphysis. Pressure epiphysis are seen at the ends of long bones which are subjected to pressure, and these ends of long bones are going to take part in the formation of joints. All ends of long bones. Example is head of femur, the condyles of tibia, the condyles of femur. These are examples of pressure epiphysis. तो इसका आंसर क्या होगा? Tibial condyles. Answer is going to be tibial condyles. Understanding? So that is pressure epiphysis. What is pressure epiphysis? It is seen at the ends of long bones subjected to pressure. Ends of long bones subjected to pressure. The second example, the second type is traction epiphysis. So when you get this traction epiphysis is formed due to pull of the muscles. Yes students, this epiphysis is formed due to pull of the muscles. जितने भी elevations होते हैं bone पे, how do you remember this? What are elevations? Like tubercles है, trochanters है, mastoid process है, tibial tuberosity. Tubercles, trochanters, mastoid process, tibial tuberosity. These are examples of what? Traction. This epiphysis are basically formed due to pull of the muscles. इसे हम बोलते हैं traction epiphysis. The third is atavistic epiphysis. अब ये जो atavistic epiphysis है, हाँ, atavistic epiphysis है, this is functional in lower animals. Functional in lower animals. It's a separate bone in lower animals. It's a separate bone in lower animals. And जैसे evolution हुआ, as evolution has taken place, this bone has got attached to some other bone. Example is coracoid process. Coracoid process is an example of atavistic epiphysis. Are you following this? It's functional in lower animals. It's a separate bone in lower animals. And जैसे evolution हुआ, as evolution has progressed, this bone has lost its importance. It comes and fuses with some other bone. Example is coracoid process of scapula. And the last epiphysis, anyone? The last epiphysis is an aberrant epiphysis. Aberrant, yes, os trigonum of talus. There's one more. एक coracoid process है, दूसरा है os trigonum of talus. So that's an extra epiphysis. Now aberrant epiphysis. Tell me, aberrant epiphysis is an extra epiphysis. Extra epiphysis. Okay. Example बोल सकते हो? Example of this extra epiphysis. The first metacarpal bone. First metacarpal bone. There's an extra epiphysis, additional epiphysis. उसे हम बोलते हैं aberrant epiphysis. Aberrant is an extra epiphysis. Is this clear? This much is clear to all of you students. I'll just brief you before we begin. I'll just brief you about our platform. Okay. Now see students, we've got this. So congratulations to our FMG students who have scored very good marks in the recent results which were declared on December 30th. These are all the students who have got very good ranks in the FMG exams. We congratulate all of them. And boost your medical preparation students. This offer is valid from 10 till 12th of Jan. 10 Jan till 12th of Jan. For 24 months you get 4 months free. For 12 months you get 2 months free subscription. So you can always avail this offer. Validity is from 10 to 12th of Jan. Subscribe now. You can use any educator code to get an additional discount of 10%. Plus subscription in which there is daily live classes, live quizzes, learning from the top educators, access from the device of your choice, and now student you can also access the question bank. Iconic subscription in which you get the best of Unacademy and pre-platter. Some special class features in which there are daily live classes, live quizzes, raise a hand technique, poll for the learners. Never miss a class with proper notifications being given. And suppose if you miss the class, you get lecture notes in the form of PDF. And anytime, anywhere you can access the class and get your doubts solved. A highly effective and updated question bank has been prepared with detailed explanatory answers specially for you. Raise a hand technique in which if you press the icon, you can directly talk to the educator. Students, we are starting with 2 new batches. Target NEET PG 2022 MCQ discussion batch from 12th of Jan and Focus FMG 2022 comprehensive batch from 12th of Jan. Okay, this is for 6 months and this is for 3 months. Download the Unacademy app and subscribe to it. Fine. Okay. Khatam nahi hua. Chalo, if you can just identify this slide for me. Yes, answer this. Can you identify the slide, students? The histological slide. Anyone? I'm waiting for your answer. Yes, students. Anyone else? Anyone else? Come on, students. Think over it. Small intestines, villus, very good. Villus dekh raha hai, very good. Haan. That is how you should be able to analyze it. See, you can see the villus, hai na? The moment you see this villus, it has to be small intestines. Perfect. Up small intestines mein, how do you differentiate between duodenum, jejunum and ilium? So in duodenum, see, this is the submucosa, hai na? Ye submucosa hai. In this submucosa, you get this glands here. You can see this glands in the submucosa, and these are the Brunner's glands. Brunner's glands. So Brunner's glands in the submucosa are characteristic of what? Duodenum. So this is going to be a slide of duodenum. You know the layers of GIT, right? Correct. You know the layers of GIT. The one is mucosa. The second one is submucosa, muscularis externa, and serosa, right? No, serosa. Tell me, mucosa is made up of three layers. What is that? Epithelium, lamina propria, and one is the muscularis mucosa. Epithelium, lamina propria, and muscularis mucosa. Students, this muscularis mucosa is a characteristic of what? The GIT. The muscularis mucosa is a characteristic of GIT. So in the entire GIT from the esophagus till the anal canal, you are going to get the muscularis mucosa. Correct? So submucosa, muscularis externa and serosa. This muscularis externa is made up of inner circular and outer longitudinal muscles. Inner circular and outer longitudinal muscles. Okay. So perfect. You get villus. So that's small intestines. Villus with Brunner's glands in the submucosa. That's duodenum. If you get such rounded lymphoid follicles, tell me what is that? If you get such lymphoid follicles, what is that known as? That is the ilium. So villus with Peyer's patches. That's the ilium. Okay. And you don't get anything there. You do not get Brunner's glands also. You do not get Peyer's patches also. So this is going to be what? Jejunum. Agar Brunner's glands bhi nahi hai, Peyer's patches bhi nahi hai, lymphoid follicles nahi hai, then it is jejunum. Clear to all of you? So that's how you differentiate between duodenum, jejunum and ilium. And tell me, students, you can see some empty spaces here. Empty, khali spaces dikh rahe hain. You can see such empty spaces. What are those empty spaces? What do those empty spaces represent? Very good. The empty spaces represents what? The goblet cells. So goblet cells are present in stomach. Yes, they are present in stomach. They are present in small intestines. And you get large number of goblet cells. Plenty of goblet cells in colon, the large intestines. So plenty of goblet cells are characteristic of what? Colon. And tell me, goblet cells are absent in which part of the GIT? Can anyone answer this? Goblet cells are absent in which part of the GIT? Students generally in a stomach likhte stomach, which is wrong. Stomach may be goblet cells hote. So goblet cells are present in which part of the GIT? Can anyone answer this? Yes, goblet cells are absent in anyone? Students, come on. Esophagus. Yes, goblet cells are absent in esophagus. because goblet cells है ना walls में होते हैं, they are in the walls of the epithelium, epithelial walls में goblet cells होते हैं. And suppose if you place goblet cells in the esophagus, when we eat food, there's going to be friction, and this goblet cells will die. The goblet cells will die if they are placed in the esophagus because of friction. So what is done in the esophagus? There's something special there. Goblet cells nahi hai, so someone should lubricate them. Yes, someone should lubricate the esophagus. So who's there? There's a special arrangement. Yes, there are submucosal glands. Submucosal glands. Esophagus में glands होते हैं in the submucosa. So these are the submucosal glands, and that is how they lubricate the esophagus. I hope this is clear. So goblet cells are absent in esophagus. Just remember this, and no controversy on this. No controversy. Goblet cells are absent in esophagus, and plenty of goblet cells you get in colon. Colon. Yes, Srasti has been attending since a long time. Srasti has got a good rank also. Okay, thank you to all of you. So I end my lecture here. So again we'll meet. This was only a half-hour lecture. So again we'll be meeting, and avail the F4 of Unacademy. You can join any of the courses. Thank you. Thank you to all of you. Thank you. And we'll meet once again later. Thank you.